When it comes to sex, there's often a huge gap between perception and reality. In today's world, so much of what we see and hear about sex, whether through movies, social media, or casual conversation, creates unrealistic expectations about what normal intimacy should look like. Many people believe that great sex means lasting endlessly in bed or performing in a way that mirrors what's portrayed in the media. But as a urologist and pelvic surgeon, I can tell you that those ideals often do more harm than good. The truth is, sex isn't a competition or a performance. It's a deeply personal experience that depends on communication, comfort, and connection. Yet, the pressure to perform for a certain amount of time can lead to unnecessary anxiety and even strain relationships. I often see patients who come into my clinic convinced that something is wrong with them simply because they don't match up to what they think everyone else is doing. They'll say, "I only last a few minutes. Is that normal?" Or, "My partner thinks I finish too quickly. Should I be worried?" And what's interesting is that when I ask where these expectations come from, most admit they've never had a real conversation about it. Instead, their beliefs are shaped by what they've heard, seen, or assumed. Unfortunately, that misinformation creates a lot of unnecessary shame. The question of how long sex should last has fascinated researchers and patients alike for decades. But before we talk about averages or numbers, it's important to define what we actually mean by sex. In one major international study that looked at this question, the researchers specifically defined sex as the time from penetration to ejaculation, not including foreplay, kissing, touching, or any other form of intimacy. This distinction matters because while many people measure sexual satisfaction by duration alone, the reality is that foreplay and emotional connection play a huge role in pleasure and fulfillment. Still, for scientific purposes, researchers needed a consistent way to measure intercourse duration, and penetration was a standardized metric. In this study, 500 couples from around the world agreed to help researchers measure the actual time from the start of penetration to ejaculation. Each couple was asked to use a stopwatch to track their intravaginal ejaculatory latency time, or IELT, a term that simply describes how long intercourse lasts before ejaculation occurs. The results were eye-opening, not because they revealed something alarming, but because they shed light on what's truly average rather than what society makes us believe. Before I share the data, I want to emphasize something important. Numbers can give us perspective, but they don't define satisfaction. Every couple's idea of fulfilling sex is different. Some partners might find that a few minutes of penetration combined with plenty of foreplay feels perfect. Others may enjoy a longer duration. What matters most is mutual enjoyment and open communication, not hitting a specific time goal. That said, understanding the data can help ease unnecessary worries. Many men, for example, assume that lasting 15 to 20 minutes is the standard. In fact, when surveyed, men estimated that the ideal duration of intercourse should be around 16 minutes, while they believed most people last about 9 minutes. These numbers set up unrealistic expectations, often leading men to feel inadequate even when they're well within normal range. When researchers analyzed the stopwatch data from those 500 couples, they found something very different. Across all participants, the average duration of penetrative intercourse was 5.7 minutes. Yes, just under 6 minutes. There was, of course, variation. The shortest recorded time was about 6 seconds, while the longest extended to 55 minutes. But when averaged out across all participants, 5.7 minutes was the consistent global mean. Interestingly, the study found regional differences too. For example, couples in Turkey averaged 4.4 minutes, while those in the United Kingdom lasted closer to 10 minutes. Now, hearing that number, 5 or 6 minutes, can surprise a lot of people. Many expect it to be much longer. But these findings are a reminder that our cultural perceptions don't always match biological reality. The human body isn't designed to follow a clock. Ejaculation is influenced by numerous factors, including arousal levels, emotional connection, physical fitness, stress, and even how recently someone has had sex. For context, the intravaginal ejaculatory latency time, ILT, is simply a measure of one aspect of the sexual experience. It tells us nothing about the quality of that experience. In fact, studies consistently show that satisfaction for both men and women depends far more on emotional intimacy, mutual pleasure, and communication than on the clock. So while this study provides a helpful reference point, it's only one small piece of a much bigger picture. As for what women want, research in this area is surprisingly limited. There isn't a strong scientific consensus on what women consider the ideal duration of intercourse, mainly because sexual satisfaction among women is influenced by many more variables than just time. However, one online survey of around 4,000 women found that, on average, Respondents preferred intercourse lasting about 25 minutes. But again, it's important to interpret that with caution. These were self-reported estimates, not scientific measurements, and preferences varied widely. What truly matters isn't meeting an average, but finding what feels right for both partners. As a doctor, I always remind patients that if sex feels too short or unsatisfying, it doesn't necessarily mean something is wrong physically. Often, it's simply a matter of expectations versus reality, and when real concerns do exist, like premature ejaculation, delayed ejaculation, or difficulty maintaining an erection, there are effective evidence-based treatments available. The first step is starting the conversation, whether that's with your partner, your healthcare provider, or a certified sex therapist. It's also important to remember that timing isn't the only or even the most important measure of sexual health. A healthy sex life involves mutual pleasure, trust, and understanding, and sometimes focusing too much on duration can take away from the joy and spontaneity of the moment. So if you've ever wondered how long sex should last, the answer is simpler than you might think: long enough for both partners to feel connected and satisfied. Numbers can guide us, but intimacy is about so much more than minutes. In the next chapter, I'll explain how these averages relate to real-world sexual function, why so many people misunderstand what's normal, and what medical science tells us about premature ejaculation, endurance, and satisfaction. When patients come to see me about how long they last in bed, the most common emotion I encounter is an embarrassment. It's confusion. They've read so many conflicting things online, heard stories from friends, or absorbed myths from media that they don't know what's normal anymore. And that confusion can quietly evolve into performance anxiety, self-doubt, and even avoidance of intimacy altogether. What I want people to understand is that sexual endurance isn't just about lasting longer. It's about understanding your body, your mind, and your connection with your partner. Let's start by exploring what actually influences how long intercourse lasts. The duration of penetration, medically measured as intravaginal ejaculatory latency time, ILT, is affected by a combination of biological, psychological, and relational factors. On the biological side, the most significant influence is the body's ejaculatory reflex, a complex process involving the spinal cord, brain, and reproductive organs. When arousal builds, nerve signals travel from the brain to the genitals, leading to muscle contractions and eventually ejaculation. This process is partly involuntary, meaning it's not something a person can completely control by sheer willpower. However, that doesn't mean there's nothing you can do to improve control or awareness. From a psychological standpoint, anxiety plays a tremendous role. The more a person focuses on not ejaculating, the more likely they are to do exactly that. This is known as the spectator effect. When someone becomes overly self-conscious during sex, they stop being present in the experience and start mentally monitoring their performance. This internal pressure can trigger the sympathetic nervous system, which speeds up the body's response instead of slowing it down. It's a physiological paradox. The more we worry about lasting longer, the quicker we reach climax. There's also an emotional and relational layer. Couples who communicate openly about their needs, desires, and comfort levels tend to report higher satisfaction regardless of how long intercourse lasts. When partners feel secure and understood, the anxiety surrounding performance naturally diminishes. This is why I always stress that lasting longer should never become the sole measure of success in bed. A healthy sexual relationship depends far more on connection than on clock time. Now, let's address a common concern: premature ejaculation, or PE. Clinically, PE is defined as ejaculation that occurs sooner than desired, often within 1 minute of penetration, and is accompanied by distress or frustration. It's one of the most common male sexual disorders, affecting up to 30% of men at some point in their lives. But here's what I want everyone to understand. PE doesn't make someone broken, weak, or abnormal. It's a treatable medical condition, not a moral failing or a reflection of masculinity. The causes of PE can be multifactorial. Sometimes it's related to heightened sensitivity of the genital nerves or certain neurotransmitters in the brain, particularly serotonin. In other cases, it's tied to anxiety, relationship issues, or even early sexual conditioning, such as learning to climax quickly during adolescence for privacy or fear of being caught. Understanding the root cause is key because treatment looks different for everyone. For example, behavioral strategies like the stop, start, or squeeze techniques can help train the body to recognize and delay the point of no return. These methods involve bringing oneself close to climax, pausing, and then starting again, essentially retraining the brain-body connection. Over time, this can help men gain more awareness of their arousal patterns and develop better control. In some cases, pelvic floor physical therapy can also make a difference. The pelvic floor muscles play an important role in ejaculation, and strengthening or learning to relax them appropriately can improve endurance. Medically, doctors may recommend selective serotonin reuptake inhibitors, SSRIs, which are antidepressants that have the side effect of delaying ejaculation. When used in low doses, they can help increase ILT and confidence without significantly altering mood. Another option is topical anesthetics, creams or sprays that temporarily reduce sensitivity. The key, however, is individualized treatment guided by a healthcare provider. Beyond treatment, education is essential. I find that once patients learn what's truly normal, that the global average of intercourse is around 5 to 6 minutes, their anxiety decreases dramatically. They realize that they're not underperforming at all. Many men who thought they had a problem are actually within the average range. The issue isn't their biology, it's the unrealistic narrative they've been taught. On the other end of the spectrum is delayed ejaculation, a less common but equally distressing condition where orgasm takes an unusually long time or doesn't occur at all. This can be caused by certain medications, neurological disorders, or psychological barriers. Like PE, it requires a compassionate and individualized approach, often combining medical review with therapy. The overarching goal in both situations is to restore confidence, communication, and comfort, not just to adjust a number. Another important dimension of this discussion is how foreplay fits into the equation. The study I mentioned earlier measured only the duration of penetration, but for most couples, that's not the full picture of intimacy. Foreplay, kissing, touching, oral sex, and emotional connection is often where much of the pleasure and bonding occur. In fact, many women reach orgasm through clitoral stimulation rather than penetration alone. So if a couple focuses exclusively on the clock duration of intercourse, they're missing the larger, more meaningful context of shared pleasure. I often remind patients that sex is not a linear act. It's a dynamic exchange that can vary dramatically from one experience to the next. Stress, fatigue, hormones, relationship satisfaction, and even the time of day can all influence how long intercourse lasts. Expecting it to be the same every time is like expecting every conversation to last exactly 10 minutes. Variation is normal. In medical terms, a healthy sexual life is defined less by duration and more by satisfaction, comfort, and absence of distress. If both partners feel content, then the sex they're having is normal by definition. But if one or both partners feel consistently dissatisfied or anxious, that's when it's worth seeking guidance from a urologist, gynecologist, or certified sex therapist. Professionals trained in sexual medicine can help identify whether the issue is physical, emotional, or relational and provide tools to address it. Understanding sexual endurance also requires shifting the conversation away from performance and toward connection. When couples focus on how they can enhance mutual pleasure rather than extending time, intimacy deepens naturally. In many cases, removing the psychological pressure to last longer actually helps men last longer because they're more relaxed and engaged in the moment. So, if you've ever worried that you don't measure up to what you see online or hear from peers, know this biology, not bravado, defines the average. The average time for intercourse is about 5 to 6 minutes, and that's perfectly normal. What matters most is how those minutes feel emotionally, physically, and relationally. In the next and final chapter, we'll bring all of this together, how to use this knowledge to cultivate a healthier, more fulfilling sex life, how couples can improve communication around intimacy, and how redefining normal can bring lasting confidence and closeness. When it comes to sexual satisfaction, the biggest breakthrough often isn't physical, it's psychological. Many of my patients come to me thinking they need to change something about their performance, when in reality, what they need most is a change in perspective. In the world of sexual health, we often chase numbers, duration, frequency, or even the number of orgasms. But what truly defines fulfilling intimacy isn't measured in minutes. It's measured in connection, confidence, and communication. Understanding what's normal is an important first step in reclaiming that confidence. When people realize that the average duration of penetrative intercourse is about 5 to 6 minutes, it often comes as a relief. The myth that good sex must last for 30 minutes or more is deeply ingrained in popular culture, but it's simply not supported by science. Those ideas come from movies, adult entertainment, and unrealistic comparisons that have very little to do with how real couples connect. In fact, studies consistently show that the quality of emotional intimacy, foreplay, and aftercare, those tender moments before and after penetration, play a far more significant role in satisfaction than duration alone. If you take one thing away from this discussion, let it be this: sexual performance doesn't define sexual worth. I've worked with countless men and couples who have been burdened by the misconception that a man's value in bed is tied to how long he lasts. This belief can create pressure, tension, and anxiety that make intimacy less enjoyable for both partners. When we let go of that expectation, sex becomes less about proving something and more about sharing something. So how can you shift from performance-based sex to connection-based sex? It begins with communication, honest, judgment-free conversations about what feels good, what doesn't, and what each partner needs emotionally can transform the dynamic completely. Unfortunately, many couples avoid these conversations out of fear of rejection or embarrassment. But the irony is that silence tends to create more distance than honesty ever will. When you talk openly with your partner about your sexual experiences, you give both of you permission to grow, explore, and find new ways to enjoy intimacy together. Practically speaking, if you're looking to enhance endurance or control, start with mind-body awareness. Simple practices like diaphragmatic breathing, deep belly breathing that engages the diaphragm and calms the nervous system can make a real difference. This kind of breathing helps activate the parasympathetic nervous system, also known as the rest and digest system, which counterbalances the body's natural fight or flight response. When you're anxious, your sympathetic nervous system kicks in, accelerating heart rate, blood pressure, and arousal. But when you engage the parasympathetic system through steady, slow breathing, you bring your body into a calmer, more controlled state. Incorporating breathing exercises into daily life or even during intimate moments can help reduce anxiety and prolong arousal naturally. Combine that with pelvic floor exercises, the same ones often taught for urinary control or postpartum recovery, and you can build greater awareness and strengthen the muscles that control ejaculation. These are the same muscles you use to stop urinating midstream. By learning to contract and relax them consciously, you can increase control over your body's reflexes. But beyond the mechanics, it's also important to address the mental and emotional side. Mindfulness can play a huge role here. Practicing mindfulness during sex means staying fully present with your sensations rather than fixating on goals or worries. Instead of thinking, I need to last longer, try focusing on the physical feelings, the warmth, the rhythm, the connection with your partner. The more you stay in your body and out of your head, the less likely you are to feel rushed toward climax. This shift can dramatically reduce performance anxiety and enhance mutual enjoyment. If you or your partner are struggling with persistent difficulties, whether it's premature ejaculation, delayed ejaculation, or dissatisfaction with sexual experience, it may be time to bring in a professional. Seeing a urologist, pelvic floor specialist, or sex therapist isn't a sign of failure. It's an investment in your health and relationship. As a urologist, I often remind my patients that sexual function is just as important as heart or digestive health. It's a vital part of your overall well-being. Sex therapy in particular can be life-changing. Certified sex therapists are trained to help individuals and couples navigate emotional and physical barriers to intimacy. They create a safe, non-judgmental environment where you can explore concerns, unpack anxieties, and learn practical techniques to enhance pleasure and connection. Many patients are surprised by how much of their difficulty resolves once they simply understand their own bodies better and release long-held shame or misconceptions. It's also worth noting that a healthy sex life isn't about consistency, it's about adaptability. There will be times when stress, fatigue, hormones, or medical conditions affect your desire or performance. That's normal. What matters is how you and your partner respond to those moments. If you treat them with patience, humor, and compassion instead of frustration or blame, intimacy will continue to thrive. When people hear the average IELT, 5 to 6 minutes, they sometimes feel disappointed, as if that's too short. But think of it differently. Those few minutes can be rich, connected, and deeply satisfying when surrounded by meaningful foreplay and emotional closeness. Remember that penetration is just one part of the sexual experience. The laughter, the eye contact, the touches, the aftercare, those are all part of sex too. The more we broaden our definition of intimacy, the more fulfilling it becomes. As a physician, my goal is to help patients see sex not as a test to pass, but as an experience to share. When you approach it that way, you begin to value communication, curiosity, and kindness over performance. You'll find that the pressure to last longer fades naturally as intimacy deepens. If I could leave you with one final message, it would be this: you are more in control of your sexual health than you think. With the right information, awareness, and support, you can build a sex life that's not only satisfying, but also emotionally and physically enriching. Don't compare your journey to anyone else's. Your body, your partner, and your relationship are unique. So whether your average is 3 minutes or 15, what truly matters is that you and your partner feel connected, respected, and fulfilled. Good sex isn't about duration, it's about presence. It's about showing up for your partner and for yourself with honesty and care. Because at the end of the day, intimacy is not measured in time, it's measured in trust, tenderness, and joy. And always remember your sexual health is part of your overall health. Take care of it, talk about it, and seek help when you need it, because you're worth it.